Hi, I just wanted to post a quick video about PCOS following our poll that we had earlier in the week. So we asked what was the most common symptom of PCOS, and the overwhelming majority of you said excess hair or infertility, which is interesting because actually the most common feature is irregular or absent periods. PCOS affects how you ovulate, which is probably how the name was originally come up with. Also, the fact that they found lots of cysts on ovaries when they scanned them. But actually, PCOS is diagnosed on 2 out of 3 factors: irregular or absent period cycles, high androgens to testosterone, which often leads to the acne and the excess hair. So you were right. And then the third one is seeing follicles on an ultrasound scan on your ovaries. You don't need all 3 of the above. You need only 2 out of the 3. And actually, quite often, the more I'm seeing of patients with diagnosis of PCOS, they actually haven't found any ovarian cysts at all. And that means that lately, people have been starting to wonder if actually PCOS, polycystic ovarian syndrome, is the right name for it. Should it be called something else? Because actually, one of the main issues, also, as well as infertility and absent periods, is insulin resistance. That also has massive impacts on metabolism and hormones. And this is why I've been talking about PCOS this week. Not only is it PCOS Awareness Month, but also it has major impacts on the thyroid. It also mimics quite a few of the thyroid symptoms. So why does it often overlap? Because fatigue, weight changes, irregular cycles are also thyroid symptoms. But also, as I mentioned in one of our posts earlier, as well as being insulin resistant, often PCOS patients are also T4 hormone resistant. That means that they're not able to cope with too much T4. So often we're giving them levothyroxine and lots of it, and actually they find their body can't cope with it, and they're much better having higher levels of T3 liothyronine. So it remains to be seen whether PCOS will be changed names at some point, whether it will be called a metabolic syndrome. It should be, in my view. Whether it will be called something completely different, who knows? But essentially, that is what PCOS is. Irregular cycles which can lead to infertility, high levels of testosterone and or little cysts found on the ovaries. But the major issue is often insulin resistance on top. I hope that makes some sense. I have written a Substack on that for you to maybe get more sense out of rather than me jabbering on. Please let me know. And keep following us. There'll be more tips and information coming up.